Feel the spinous processes. Approximately 2 fingers lateral lies the lumbar facet joint. Mark entry point, clean and firmly stretch skin, and rapidly insert a 3 to 4 inch spinal needle perpendicularly. Pass needle down to gently touch bone. Aspirate and inject in or around the facet joint as a bolus. Palpate the posterior superior spines on the ilium. An equilateral triangle has its apex at the base of the sacrum, just above the buttock cleft. Identify the 2 sacral cornua and mark entry point just distal to this. Clean and firmly stretch skin and rapidly insert needle perpendicularly. Angle proximally at about 45 degrees, although this is very variable. The needle may have to be changed several times to ensure that it passes through the sacral hiatus and slides a short distance slowly into the canal. Aspirate to ensure no cerebrospinal fluid or blood is present, and then inject slowly as a bolus. Feel the posterior superior spine on the affected side. Mark entry point about a thumb width medial and a thumb width distal. Clean and firmly stretch skin and rapidly insert needle perpendicularly. Angle 45 degrees obliquely upwards and laterally, entering through the posterior ligament into the joint. The angle varies with different body shapes. Aspirate and inject as a bolus. Identify the sacral cornua, the 2 little bumps just above the buttock cleft. Move distally to the sacrococcygeal joint line. Mark the entry point, clean and firmly stretch the skin, and rapidly insert needle perpendicularly. Pass down to gently touch bone. Aspirate and pepper around the ligamentous attachments. The patient is inside lying and opens and closes the jaw, so the bump of the mandible can be felt rolling forwards. The patient keeps the jaw open, mark the entry point just anterior to the mandible, clean and firmly stretch the skin, and rapidly insert needle perpendicularly. Pass needle into joint space, aspirate and inject as a bolus.